I am Dr. Felice Gersh. I am an integrative physician. I specialize in the whole body, helping to harmonize all the different aspects so that every person can be optimally healthy. Well, that's really quite challenging now in this new era of the coronavirus. I just want to let you know I am located in Irvine, California. You are actually looking at me as I sit in one of my exam rooms. I don't have a movie studio, so this is just one of my exam rooms that I set up this way. And I am open for business. We are doing almost all of our work now with telemedicine, but I have been seeing about one patient a day in my office in person to do things like take cultures, do exams when people have pain, and do biopsies. So there are certain things I cannot do remotely. So we are open for business and we are taking extreme measures to protect all of my staff and my patients and of course myself, because I realize if I go down, I will not be there to help anyone. So what are we going to talk about today? Well, we want to talk about how you can be prepared. If there's one thing we know is that you can't wait. If you thought that this is like on the distant horizon, you now know that is not true. Depending on where you live, you may be heavily impacted right this minute, but there is not a state in the US that doesn't have the virus there. And some, as you know, have many deaths already, and many that have not even been counted as coronavirus deaths because not everyone is being tested, as we know, although testing is now being ramped up. And we're going to do a whole show talking about testing, who should get tested, and so on, but not for today. For today, I want to talk to you about what should you have in your home. If not this minute, like how about in the next minute, very soon? What should you have on hand? Like what should be in your medicine cabinet? And also like what should not be in your medicine cabinet? What would I not want you to use? Well, let's talk first about what should be there. And I want everyone to have some magnesium, zinc. I would like all of you to have your vitamin D. And don't forget NAC, N-acetylcysteine. So I put together what I call my immune support package. These are just foundational things that are required to have a functional immune system. The first is zinc. Zinc is all about healing. I know many of you have heard about zinc lozenges and zinc sprays for colds, for the common cold, which is a coronavirus. Well, I am not against that, but I am recommending taking in 30 milligrams of zinc orally every single day. That amount of zinc really enables your body to function properly. We're not going to do a deep dive into biochemistry and physiology and cellular biology, but I want you to know, and if you're interested, just Google it if you have time on your hands. Zinc is critical for proper healing, for proper immune function, for proper cell functioning and health. So that's foundational. Another is vitamin C, and I like to give it in the buffered ascorbic acid form because when it's buffered, remember ascorbic acid, it's kind of irritating if you take a lot of it for the GI tract, like for the stomach. So I prefer the buffered form so you don't get any kind of irritation, because I'm talking about taking it in really not physiologic levels, but really pharmacological doses, really higher levels. Now, not when you're just trying to stay healthy. So for that, you can do 500 milligrams, 1,000 milligrams a day. But we'll talk about what happens if you start having symptoms, but that's good just for background amounts. And vitamin D. There is so much published data on the importance of having adequate vitamin D. Now, you don't want to just really take lots of vitamin D by itself. You really need to have it with vitamin K2, which is normally made in the gut, magnesium, zinc. Vitamin D, like everything, doesn't work in isolation. So we want you to also get some sunlight. Now, right now, we're getting to the time of year that you can actually go out in the sun and make vitamin D and other antioxidants from sun exposure on your skin. And remember, when you go out in the sun, your eyes have receptors, so you will actually make more serotonin, so you'll feel happier and calmer. You will also make more melatonin, so you will sleep much better at night. So you want to get a lot of sun exposure on your skin as much as you can. That's not always doable, but when you can now, because we're heading right into April, this is the time. We have these few months from spring until early fall when we can actually make vitamin D with sun exposure. And that is really the best way. And it's not just vitamin D, it's also other antioxidants. But in the meantime, you should all be taking vitamin D. For just basic amounts, 2,000 IU a day is really very good. Now, what else? I recommend in my package N-acetylcysteine. This is a derivative of the amino acid cysteine, and it has a whole host of benefits in the body. But the one that we're focusing on, is immune system support. There's actually published data that it helps to prevent viral infections. No, it's not a panacea, it's just a help. And every little help is that much of a buffer for you not to become severely ill. We're expecting so many of us will actually catch this virus, no matter how careful we are. But that doesn't mean that you'll end up in a hospital trying to vie for others for that ventilator. No, we don't want you to ever get near a hospital. So even if you catch this virus, and we want to, of course, prevent that, but if it happens, we want you to be the mild case. That's my mission now, because we're not talking right now about washing your hands and staying in social isolation and social distancing. We've talked about that, and we'll talk about that more. But now it's about revving up your immune system to be optimally functioning so that you, if you catch that virus, you will not become a terrible statistic, or your family members. This is not what has to happen. And once again, like, we know that the majority of people actually don't have any serious long-term consequences from catching this virus. So what differentiates the ones who do well and the ones who do really poorly? Well, I know you've heard it's pre-existing conditions: obesity, diabetes, heart disease, cardiovascular disease. These are all signs of people who have inherent levels of inflammation, chronic inflammation. This is the enemy, because your immune system is already not functioning properly when you have a chronically inflamed body. So no matter what your weight is now, it's the time right now to take action to get optimally healthy. Maybe you won't be perfect because we have like a week or a month to really work on you, but starting today, I want you to make sure that you take those few supplements I mentioned. That's not, overkill. That's just a few supplements just for basic maintenance. Okay? So we're going to talk over and over again about what you should do to stay healthy in terms of eating. But right now we're talking about what's in your medicine cabinet and what should not be in your medicine cabinet. What do I not want there? Advil, ibuprofen, Motrin, those are the brand names in the generic ibuprofen. I know this is somewhat controversial, but I'll tell you my opinion. Once again, this is not just a random guess. It's based on science and evidence. Okay, so what do these non-steroidal anti-inflammatories like ibuprofen, naproxen, and so on, what do they do in the body? They're actually interesting in that they block both the COX-1 and the COX-2 enzyme system. Now, some of these COX-2, that's all the inflammatory pathway. And you think that might be good, and maybe it is, but not right at the onset of an infection. But it also partially blocks the COX-1. The COX-1 is about maintaining calm, homeostasis, anti-inflammatory. Everything in the body, the Chinese got it right, yin yang, it's all about balance. So we have COX-1, like anti-inflammatory pathway, COX-2, pro-inflammatory pathway. It turns out that these non-specific anti-inflammatory non-steroidals are actually blocking, to some degree, both. Okay, so that is not good, because you need, first of all, both to be functioning properly. Why would you want to block your body's ability to become inflamed when it's supposed to be inflamed? You don't want to have inflamed arteries. You surely don't want to have an inflamed brain, but you do want your immune system to create inflammation to fight off an invader like a virus, like coronavirus. You don't want to knock out your immune system. So we know that people who are on immune modulators because they have autoimmune disease, or they're on chemotherapy, which affects the immune system, they do not have a proper, robust immune response. You don't want to block your natural immune response. On the other hand, you also don't want to block your anti-inflammatory response, the yin-yang, the balance here, so that you can go and transition from inflammation to anti-inflammation. These drugs block, to some degree, both of those pathways. And they're directly toxic to the gut. We now know that this virus, the coronavirus, enters into the cells through the cell membranes through a certain receptor, the ACE2 receptor, which is found throughout the body in all the vascular structures, in the pulmonary structures, the alveoli of the lungs. It's also in lymph nodes, it's in the brain, and it's in the GI tract, the entire GI tract, the stomach, also the mouth, the oral pharynx, the small intestine, the large intestine, the liver. Okay, so these receptors are present everywhere. The virus can be involved and is in all of those places. You do not want to take something that is directly toxic to your GI tract. You all know that you can get bleeding, right? Bleeding ulcers and such from taking these drugs. This is not the time to actually damage your lining tissues of your GI tract. Trust me, you do not want to do that. What else do you not want to do? You don't want to take PPIs, proton pump inhibitors, those ubiquitous drugs, like a little purple pill. There's a whole bunch of them on the market. Those drugs that block the stomach's ability to make stomach acid. Why do we have stomach acid? Is it there to annoy us? Of course not. You have to have stomach acid. It actually kills invaders. It's killing bacteria, viruses. It is a killer. It's also part of digestion. You know, everything in the body is multitasking. So stomach acid is really important to protect the health of your GI tract and to properly digest food. We've talked about food. Do you want to actually digest and get the nutrients of the food you eat? Of course you do. You do not want to do that. Take these drugs. There's actually published data that taking PPIs, proton pump inhibitors, increases the risk of pneumonia. Oh, come on. You want to take a drug that increases pneumonia at this time? I don't think so. Now, if you have problems, if you are suffering from acid reflux and you don't know what to do, I can't go into that right now, but you know I'm open for business. You can call me. I will go over what to do to help you. Or call your own doctor, and hopefully that doctor will tell you something other than take more PPIs. Okay, that is not the treatment for you. Please do not do that. So what else should you be doing? Well, I want you to know that if you do get sick, we need to change your program a little bit. So if you start having symptoms, and hopefully you can get tested. If you know that you have the coronavirus, or you think you do because you can't get tested, and if you call your own doctor and your doctor says, well, you're not sick enough, you're not so short of breath, or you're still oxygenating, so you stay home. So what should you do? Go into your bedroom and close the door and then, start praying? Well, you can do that, but you can do a lot more than that, okay? So that's the time when you should start thinking high doses of such things like melatonin. By the way, you can take small amounts of melatonin, like a half a milligram or a milligram, an hour or 2 hours before you go to bed. That will help to stimulate your own body's production of melatonin. We've talked about sleep. This is critical. But now, if you actually get the coronavirus, and I want to tell you, everything I'm going to tell you is not, I have to give you disclosure, this is not designed to treat you because I am not your doctor. These are just what I would do for myself. And please, you should discuss this with your own physicians, because I'm not here to treat you. I just want to give you what I am going to recommend for myself, my family, and most of my patients. But please, I'm not your doctor, so unless I am your doctor, but if I'm not treating you. I'm just telling you stuff that is evidence-based that I would definitely do myself. I wanted to let you know, I, to my knowledge, do not have the coronavirus at this time. I'm feeling great. But we never know, right? Because half the people or more are walking around who are asymptomatic and they don't actually get symptoms at all, or they don't get them for several days. So can't really say. None of us know for sure, because we could be negative today, positive tomorrow as well. So the bottom line is, if I get positive for coronavirus, I am going to start taking high doses of melatonin, probably about, and this is not as high as they can go, but I would probably go up around 10 milligrams at night for melatonin. I would also for sure take the innate immune support that I have on my website. It has in it some really beneficial and tested herbals: astragalus, astragalus, an extract of Asian mushrooms. These are really boosters to the innate immune system, which we really want to rev up at that time. We want our immune cells to really win this battle. Okay, we want to win. So I would definitely take that. And there's a new one that I'm just now adding, and that is astaxanthin. Now, what is astaxanthin? Astaxanthin is a carotenoid. It is the most powerful of all the carotenoids. Carotenoids you probably heard of, like from orange vegetables, carrots. They have like beta carotene. They're from the polyphenol group known as the carotenoids. And I always have to look at it because I always have to read it. Astaxanthin. That particular one is found in great quantity in wild salmon. It's what gives wild salmon the pink color. Now, sadly, if you buy farm salmon, they use food coloring, and it really doesn't have very much. In fact, wild salmon has at least 4 times the amount of astaxanthin than does farm salmon. So, and farm salmon is filled with PCBs. You do not want to eat farm salmon, please. Not now. Maybe for an occasional, you go out to a wedding or something, but not today, not anytime now. Only farm salmon. Now, I have always been saying, well, be careful about salmon and all the ocean fish because they have mercury, and it's true. But salmon has less mercury, for example, than swordfish or halibut or tuna for sure. And I have to pick my battles. We have to decide what is our priority at this moment. So I will let the mercury issue die down a little bit. By the way, taking NAC and all the other things they're also going to help. Eating lots of vegetables will help your innate detoxification pathways in your liver to function properly. And eating a lot of fiber binds the mercury so you can poop it out too. So I'm going to pick my battles, and I want to have lots of that wonderful carotenoid, I always have to look, astaxanthin. And so I'm going to start eating wild salmon like every other day now, okay? And it's frozen, defrosted. It's fine. I like it. So I want to have a good serving because I'm going to get it naturally. But if I actually get sick, I am going to take it as a supplement. And I am going to be putting that on my stores shortly. And it'll have the dosing and so forth. Now, it works best if you take it's fat soluble, if you take it with a fat. So omega-3 fish oil is great, but you say you're not going to do that for whatever reason. You can also eat flax seeds, chia seeds, sunflower seeds, pumpkin seeds, or nuts. They're fine. Any of these wonderful fatty kinds of foods will help you to absorb it, and it actually works synergistically to work far better when you take the supplement, the astaxanthin, with an oily type of food or a supplement like omega-3 fish oil. So that is what I would do. I would also, like I mentioned, I'd rev up taking twice a day my innate immune support supplement, and I would increase my vitamin C. Now, I have to tell you, if you're a male and you go way high on your vitamin C, you have the potential to trigger kidney stones. So just please be aware, it tends to be more of a male thing. If you take a lot of oral vitamin C, you can also trigger, and I use, like I mentioned, the buffer type so you don't get irritation in the stomach, but you can get diarrhea. If you get diarrhea, that's not good because you won't know if it's from the vitamin C or if it's from the coronavirus. So I'm not pushing it too high, but you can usually get up to, say, 3,000 milligrams, 3 grams a day without getting into any of that trouble. And you can work your way up. But that usually is not a bad dose for anybody. And as well, for example, 3 grams, that's the dose that people take for exercise-induced asthma. If you take that amount and then you exercise, if you tend towards developing exercise-induced asthma, that is the generally recognized and recommended dose for that. So now I want to also make a couple of other suggestions well, not really suggestions. I just want to give you some information about the future. Like, where is the future? Where is the research now? What about the drugs? I'm sure you've all been hearing about chloroquine and hydroxychloroquine. So chloroquine is an old drug to fight malaria derived from quinine. And you know what else comes from quinine? Tonic water. Isn't that interesting? So actually, but I'm not telling you to go out there and drink a ton of tonic water, but I just thought that's really interesting that quinine is in tonic water. So they made this drug and it seemed to be somewhat effective against malaria. It's not used much now because malaria, like all the other organisms out there, they kind of outsmart us, and most malaria is now resistant to chloroquine. So it's not used much anymore. But hydroxychloroquine is a drug that is used in certain autoimmune conditions, particularly rheumatoid arthritis and lupus. Okay, the brand name is Plaquenil. So it's used very commonly, and it has a variety of mechanisms, much of which is not even totally sure. And there's a lot of theory. In fact, I read a big long paper on the mechanism for how hydroxychloroquine is working potentially against the coronavirus, and it was really complicated, and it was all hypothesis. So I'm not going to even go into that. But what we do know is not enough, but it's something. It's actually now being promoted all over. And the pharmaceutical companies that make hydroxychloroquine are revving up production, and it's coming to a hospital near you. The question is, what's the timing? So if they're reserving it for really critically ill people, that may actually not be the right time. It may be that it's really better to take it at an earlier stage. The problem is we're in an early stage of knowledge in this pandemic, and nobody really knows what to do. I do know of actual cases where it was prescribed early on and medium in terms of the symptoms, and the people, this is now just a couple of cases that I know of, the patients actually got better quite fast. So that really makes me excited that maybe this will turn out to be really beneficial. There are some risks involved when you add it with the zithromycin. They both have QT prolongation that's relating to the heart electrical conduction system, and there will be, they estimate 1% of people who take these drugs, especially the combination of hydroxychloroquine, the Plaquenil, with the zithromycin, the antibiotic, because they both work on this QT prolongation. If you have that innately, that risk in your body, you may have a 1% chance of sudden death. So, that's kind of an important deal. So there haven't been any reports as far as coronavirus patients that I'm aware of, but there are plenty in the world. And zithromycin, for example, has a black box warning on it. If you didn't know, now you do. It has a black box warning put on it by the FDA for this very problem of causing sudden death. So that's a concern. Now, what else is out there? Well, they've been doing everything they can to try to use every kind of pharmaceutical that has any potential that already exists. So a lot of the HIV drugs have been looked at, not too good, unfortunately, but they're still working on it. Some other flu drugs, still not sure, but maybe. And then the other one, I have to look at this one, remdesivir. So remdesivir is an antiviral that was in the works for Ebola. And then Ebola kind of disappeared, and so it just kind of got put on the shelf. But there are ongoing studies with that antiviral, and some of them are looking optimistic. They're also using the antibodies from the convalescent serum, the people who have just had the infection and now have antibodies, and there's research using the antibodies from recently infected people to help boost the immune system response of people who are now being infected. In terms of a vaccine, there are multiple pharmaceutical companies all working simultaneously trying to develop a vaccine. The earliest estimates, if it's even done, will be about a year and a half to 2 years from now. So don't hold your breath on that one. That's down the road. That's not going to help us anytime soon. When we're looking at a timeline of 1, 2, 3, 4, 5, 6 weeks and so forth for massive potential mortality in our country. So what else? There are very smart minds doing all kinds of research with modeling and using computers, looking at all kinds of particles involved with existing pharmaceuticals that might work to block the entry point of the virus into the cell. We actually understand this virus quite well and how it gets into the cell, how it binds to the receptors and so forth. So they're looking at all kinds of different particles that exist on current pharmaceuticals to see if giving them might help to block the replication or the introduction of the virus into the body itself. So there's a lot of really optimistic stuff on the horizon. I feel in my heart that over the course of the next several weeks, we're going to have some really good answers because there are so many patients to work with and there are so many studies ongoing right now with all of these medications. We're going to have some pretty good answers. But empirically, now the hydroxychloroquine along with the Zithromax is being used even without really great studies. There was a 20-person study out of China which showed really good results. There was another one out of France, and then there was another one out of China with 30 people that did not show very good results. So that's about it for published data, and they're all little, not very much. So we really, have a lot of more anecdotal reports, but stay tuned as I know more, and I'm trying to keep up with everything. I will share all my knowledge and hopefully wisdom with you. So we're going to end with that. I want to end with a real ray of hope that whether you get this virus or not, you will have tools. You'll know what to take and what not to take to optimize your chance of getting through this really challenging time in the era of coronavirus. Now, I have a few questions. Some of these were put in early, so I might already have answered them. So the first one, I'm just going to reiterate. It says, I heard ibuprofen is bad for coronavirus. If I get sick and feel lousy, what should I take instead? Is Tylenol okay? Well, I already talked about ibuprofen. That no, I personally, based on what I know, I'm against it because of its impact on the COX-1 and COX-2, and also the fact that it is very bad for the GI tract. So what about Tylenol? Am I a fan? No. So Tylenol actually blocks the production of glutathione, one of the master antioxidizers and detoxifiers of the body. It's a great antioxidant. You really do not want to diminish your body's glutathione. It's so critical to functioning. Now, I don't know if you know this, but Tylenol is the number one cause of acute liver failure in the United States. The differential between the therapeutic and the detrimental in life-taking dose that can destroy your liver is very small. And the fact that it is so small, it's telling you that, remember, it's not good at any dose. Anything that can literally destroy your liver, would you really want to take that in a little less so it doesn't truly destroy your liver? But how good can it be? So what about fever? I'll just touch on this for a moment. Fever is not bad in and of itself. Fever is an inflammatory response of the body, and some people feel that in some cases the fever can actually, it's not by accident that we get a fever. Everything evolved for a purpose, that fevers can actually help to kill some of the invading organisms. But at a certain point, if it gets out of control, kind of like a runaway train, and you have incredible amounts of inflammatory products and fever out of control, you might want to lower it. But I recommend using old-fashioned cooling measures, cool compresses, evaporation off your skin. And please, if you're home, try not to really, I would not use Tylenol or ibuprofen. So here's another question asking about supplements. So I think we went over that. I just want to repeat. Basic, these are not so much, you can all handle it. Zinc, vitamin C in the buffered form, vitamin D, and N-acetylcysteine. I mean, I am not giving you what I labeled politis, too many pills. Anybody can handle that. And then I had more questions about chloroquine. I think we answered them. And then here's a question. It seems like older people are especially hard hit. Is there any way to trick the virus into thinking I am younger? I love that question. The answer is yes. How can you trick the body into thinking you're younger? By helping it to perform optimally. Having a healthy GI tract. If you need to take digestive enzymes because your GI tract isn't working right, you need to do that. You need to optimize everything. Eat the foods that maintain a healthy gut microbiome. We know as we age, our gut microbes morph into different populations. You need the right gut microbiome to maintain a healthy immune system. They're intricately connected. So you want to eat the right food. A lot of people as they age, they eat very poorly. They tend to do I've seen it. They eat like English muffins with jelly and cornflakes with skim milk. Okay, you've seen that. I'm telling you the truth. A lot of elderly people eat really poorly. I honestly think that one of the big differentials between the young people who get impacted really heavily and have bad outcomes and the young people who sail through it is their nutritional status. You know, when they say this young person ended up in the intensive care unit and had no predisposing conditions, I would love a dietary history. I'll bet you they are eating fast food, chemical foods. They're not eating organic fruits and vegetables, because you can be young and have a very poor quality immune system, and you can be old and have a really good quality functioning immune system. There have been cases of 101-year-old who got through this. They were a group of men who went on a ski trip to Italy. They were all 50 and above, and they all had no predisposing conditions. Of the group, half of them ended up in the ICU on ventilators. The one who did the greatest, had no problems, was 84 years old. So if you stay fit, you get out in the sun, you work on stress, you eat a great diet. By the way, we're going to talk about hormones in the future. Having physiologic levels of hormones. Remember, we lose our hormones when we age, but having physiologic levels of hormones and taking a few targeted supplements can help your immune system to behave as if you were many decades younger. This is for sure. So take all this information, use it as you feel best for yourselves, and I will see you back on Friday with my next Instagram Live. I hope you'll join me and let me know what you'd like me to talk about. I'm here to help you to get through this pandemic. Take care. Enjoy the rest of the day.